Now, we've all seen the numbers, the statistics, the satellite images, but from your vantage point at UNICEF, what are you seeing on the ground in Gaza today?
Unfortunately, we're seeing a return to the death, destruction, and displacement that has befallen the Gaza Strip for the last more than 15 months now. And children are the ones that are bearing the cost of that. I was in Gaza myself just a few weeks ago, and while that was a period of ceasefire, there was still tremendous suffering among children who were unable to get adequate shelter, who were freezing in the winter conditions, children without access to nutrition supplies, without access to clean water. It really was a desperate situation. Of course, since then, we've gone back to a situation where their bombardments are now threatening children's lives once again. And we've had the largest death toll in a single day in the Gaza Strip there last week. And that should shock the world into action. And yet, here we are, seeing these bombardments continue day after day, with it a growing list of children who are being killed, injured, and buried under the rubble.
And what can you tell us about the condition of the children who are alive there, the physical condition, their emotional condition at the moment?
I'm going to give you some numbers, and I think it's important to remember that every single one of these numbers is a child, but the scale here is what we have to remember, right? We're talking about 20,000 children who have been separated from their parents. That might mean they're orphaned, that might mean they're lost and unaccompanied in the Gaza Strip. 60,000 children are estimated to need a treatment for acute malnutrition this year. Every single child, all 1 million children in the Gaza Strip, need mental health and psychosocial support. We know that thousands of children are suffering from diseases, particularly skin diseases like scabies. So the impact on a child's life is coming at them from all angles. If they manage to survive the bombardments, they're still faced with the deprivation and the suffering caused by this ongoing aid blockade. We managed to reverse some of that during the ceasefire, but now, with aid stopped for more than 3 weeks, we're seeing these conditions re-emerge. More children getting sick, more children at risk of malnutrition, more children without the shelter that they need to stay warm and safe in the evenings. So it really is an impact right across the life spectrum of a child.
Now, the Gaza Health Ministry says over 200 children have been killed since March 18th and more than 15,000 since the war began in October 2023. How do we begin to process this kind of scale of loss? How do you deal with that kind of loss at UNICEF, and how should we all be dealing with that?
It should infuriate us. It should compel us to act in whatever way we can as individuals, but also as a collective international community to stop the killing of children. Now, the killing of one child is too much, let alone more than 15,000 children reportedly killed since the beginning of this conflict. If, for example, I wanted to give condolences to the families of these children, one a day, it would take me more than 40 years to give those condolences. That is the scale of the child death that we're talking about in the Gaza Strip. And as we just mentioned, the impact is not just limited to the children who have been killed, but also the children with life-altering injuries, the children who received amputations, some without anesthetic, who require ongoing care, children who are now severely traumatized by what they have experienced. I've met children in the Gaza Strip who don't speak anymore, who have been orphaned, who have lost their parents, who are suicidal. All of these facts together, the number of children killed and the children who continue to live in this horrendous situation, that should compel us all to action. But unfortunately, we are still seeing this situation continue. Not enough is being done to stop it.
When you mention things like the child who doesn't speak anymore, who wants to take his own life, or children being operated on and having limbs removed without anesthetic, I think anybody with a right mind listening and watching right now would want to do something about that. The international community talks often about access and coordination. But at this point, what's actually getting into Gaza? Is anything moving at all?
Nothing is coming in, and nothing has come in for 3 weeks. This is the longest period of time since October 2023 when nothing has entered the Gaza Strip. And that's a big problem. It's a big problem, one, because we have life-saving supplies just sitting a few kilometers on the other side of the crossing. We've got vaccines for children. We've got ventilators for hospitals that are trying to keep premature babies alive. Many, many trucks of life-saving supplies sitting just outside. Now, without those supplies coming in, the suffering of children increases. It also means that the services that we are trying to deliver in the Gaza Strip will be impacted. We cannot continue to provide treatment for malnourished children if we do not get those treatments in. So at the moment, we're still managing to run through what remaining stocks we have left, but they are getting less and less by the day. So it's critical that those supplies come in, not only so that we can deliver them, but also that we can keep the services that we operate going.
And UNICEF has made major gains during the ceasefire. Vaccinations, clean water, schools managing to reopen in whatever form that they can. How much of that progress has now been reversed since the resumption of Israel's attacks on Gaza?
A great deal of it. And it's really upsetting as a humanitarian community to be given this opportunity, a precious one, to try and do as much as we can for children. And in those 8 weeks, we really did, as you say, we were vaccinating kids, we were repairing water systems, we were bringing children back to learning, we were providing much needed mental health support. Now we are seeing the situation really be unwound again, really seeing impacts on some of those water points that we had repaired. For example, our desalination plant has again lost power. That was operating close to full capacity, and now it's down to about 13% capacity. So again, thousands more people without access to water. So a lot of the progress that we made is now being undone.
Let's talk about that Southern Gaza desalination plant, which you guys are supporting. With that electricity cut off, how are families rather surviving without clean water?
How are they surviving? How have they survived for all of this time without clean water? There's a couple of things that happen. One, we step in with water trucks, and that's what we're doing at the moment as best we can to increase water trucking so that when the systems break down, we're there with trucks. And when I was in Gaza, you see this, water trucks with long, long, long lines of people, quite often children, standing there waiting for their turn to fill their bucket or their jerry can. Now, this is not an adequate way to live, particularly for families big families that only come back with one bucket a day. But it is at least something. It is at least safe water. Now, if families can't get that because we're unable to continue the trucking or we cannot reach the areas where these families are, then many families are having to resort to unsafe water. And what that does is it risks disease. And we're seeing that in the Gaza Strip. We see disease from unsafe water, from unsanitary conditions. We also, of course, we've got a large buildup of waste that hasn't been able to move. We've got leaks to sanitation systems. So, of course, there's sewage running through places where children are playing. And all of this poses a really serious risk to the health of children, particularly young children.
And hospitals are, of course, collapsing. Supplies are gone. Doctors are completely exhausted. How close are we to a total collapse of Gaza's health system?
We've seen more than 600 attacks on the health system, according to WHO, since October 2023. And these hospitals are phenomenal. Their resilience, they continue to rebuild and then face a setback, rebuild and then face a setback. But doctors continue to work. It's hard to say how close we are to that ultimate collapse because, again, we continue to try and provide these services. We continue to try and rebuild wherever we can alongside our amazing partners and health workers, the Palestinians who are working day in, day out in the Gaza Strip to continue to save children's lives. But we're talking about only a handful of operating hospitals, and some of those are only operating partially. They're only partially functional. So the services are nowhere near what is needed. And we see that when we have a day like the 18th of March, where hundreds of people were killed, the hospitals just don't have the capacity to treat all of those severely injured patients. We as UNICEF and the rest of the UN community have been calling for an increase in the number of medical evacuations to make sure that people who need care that they cannot receive in the Gaza Strip get that care and that their lives are saved. But again, since aid has stopped entering the Gaza Strip, people have also stopped leaving for that medical care, and we are not seeing enough medical evacuations through the Rafah crossing, and only a very small handful through Kerem Shalom. So again, that has to increase to save children's lives.
And you've told us about the widespread child malnutrition. How critical a level is the situation at the moment?
It gets more critical with every day that families are not able to access food. And they can't access food because aid is not getting in, but also because commercial goods aren't getting in. So during the ceasefire, we saw markets be replenished. And as somebody who's been to Gaza several times during this war, that was one of the things that I found most heartening, was to drive down the streets and see eggplants for sale and eggs for sale. Now those materials are disappearing and the prices of them are going up dramatically. I've been speaking to friends and colleagues in Gaza who've told me that the prices of things have more than quadrupled in recent weeks. That means families can't afford food, they can't access food. Their children will go back to a situation where they're having to resort to a really limited diet, or in some cases, non-human foods. Children were eating fodder for livestock in order to survive. And that is when we see rates of malnutrition increase. The flip of that is, to treat that malnutrition, we need specific treatments. A malnourished child can't just go back to eating food. So not only do the children need food, they also need malnutrition treatments, and those are sitting on the other side of the crossing into Gaza.
And the physical effects on children is bad enough. And then we have the psychological trauma. You told us that story of that one young boy who didn't want to live anymore and didn't speak anymore. UNICEF's called Gaza's children a generation living in fear. Can this kind of trauma be reversed over time?
It's a really good question. And I honestly I think that we don't talk about this enough. We don't talk about the scars that we can't see. And when you talk to children in Gaza, it becomes very clear that very small children have experienced horrors that no person should experience in their lifetime, let alone before the age of 5. I sat in groups where children were receiving kind of group mental health and psychosocial support. And one of the activities that they were doing is to draw something that had made them sad and talk about why it made them sad. And these children were talking about horrific things. They need concerted mental health support now. Now, the question of whether this is going to last with them for the rest of their lives, we don't know yet, because it's still going. We don't know how much compound trauma will continue to add to the very long list of trauma that these children have already experienced. Every day that more trauma is added, the risk increases that this will have lifelong impacts, but we just don't yet know until the fighting stops and the child can feel safe enough to begin to process what they went through.
Now, UNRWA and other UN agencies have faced repeated attacks. 280 humanitarian staff killed since the war began, the highest in UN history. Can you give us a sense of the risks that humanitarian workers are facing on the ground, and how such loss does it affect the morale, the operations of agencies like UNICEF?
Of course it does. We're talking about brave colleagues who are trying every day to continue to save the lives of Palestinians in the Gaza Strip, but that it means putting their own lives at risk. And every time we lose a colleague, that has an impact on the humanitarian community. This week alone, 8 colleagues have been killed. Now, we shouldn't be seeing that. We have systems in place all over the world that exist to help parties to the conflict meet their obligations under international humanitarian law to keep us safe. We coordinate with them, we let them know where we're going, when we're going, who will be going, so that they can make sure that we are not harmed. And yet we have seen hundreds and hundreds of humanitarian workers killed in the Gaza Strip.
And why is that? Why is that? Why is this happening when we all know it shouldn't be happening?
Because that system, we call it deconfliction, because that system is not being respected. Because despite us coordinating, despite us letting our whereabouts be known, our time of movement be known, we're still seeing attacks like the one that occurred was it last week or the week before on the United Nations Operations Guest House? 5 colleagues seriously injured, 1 colleague killed. That premises was known, it was marked, and it was deconflicted. So that system is not being respected, and there is no reason why it shouldn't be, because that system works in other countries around the world.
And what about the international community's reaction to these kind of incidents? Do you think these words are strong enough?
I think that the international community should not only react to these incidences, but to the tens of thousands of deaths in the Gaza Strip since October 2023. It needs to provide a comprehensive response, not just to the deaths of international humanitarian workers, but all of the people who have been killed. We need to see more concerted action for a ceasefire, for the release of the hostages, and for a lasting peace process. Now, until that happens, humanitarian workers are not going anywhere. UNICEF are staying on the ground. We still have dozens of staff delivering for children, and we will continue to do so. But every day that we do so in serious danger, like the people that we serve.
Now, just staying with what you do for a moment, the UN Secretary General has announced a 30% reduction in international staff in Gaza, with reports indicating that many of those being withdrawn are essential personnel, like from UNICEF, the WFP, the World Food Programme, of course, and the WHO. How will this affect UNICEF's capacity to operate on the ground? And what does it mean for frontline services like the food distribution and vaccination campaigns and emergency healthcare?
So I can't speak to other agencies, but what I can say for UNICEF is that we have staff that rotate in and out of the Gaza Strip on a regular basis, like we do around the world. International staff come in for a mission, do their important work, and then rotate out. What we're going to do is maintain a consistent presence of dozens of staff on the ground, both national and international staff, to ensure that our services can continue. We've got health experts, nutrition experts, water engineers there on the ground continuing to provide services. But of course, our operations are impacted by the lack of aid that can come in, restrictions on our movement from north to south, the danger that we face. So there are many factors here that make the job very difficult, but the reasons to persist are more.
And with the talks stalled at the moment and the conditions getting worse day by day, what are your most urgent needs from the global community right now?
We need to see all states, particularly those with influence, continue to use whatever leverage they have to increase the pressure for a ceasefire. That remains the #1 priority. And I know that after so many months of all of us saying we need a ceasefire now, that is beginning to sound tired, but it is not a tired ask. It remains the most important ask. And we saw the benefits of that short but powerful ceasefire there in January. So we need to go back to that sort of environment where a ceasefire can be reinstated, hostages can be released, children can sleep safely at night, and ultimately hope that can get us to a lasting peace. That remains the priority. Failing that, though, we need international communities to continue to support humanitarian aid agencies like UNICEF. There are global funding cuts that threaten our operations in a time where we're seeing an increasing number of crises around the world. So it's essential that people continue to support this important work to keep children in the Gaza Strip, in Syria, in Sudan, alive.
Now, many say the world has failed Gaza, pointing to the UN Security Council's inability to enforce a ceasefire or protect civilians. Does UNICEF feel abandoned by the global system which is meant to support it?
We're a UN humanitarian aid agency, and regardless, we will continue to do our work. Those sorts of decisions are kind of happen in a hall in the United Nations, as you say, in the Security Council, where it is incumbent upon the member states that sit in those halls to take their responsibilities to protect children. And that is what we ask them to do, is to continue to keep children front of mind and our work front of mind, so that we can do the job that we're mandated to do by that Security Council.
And finally, if you could speak directly to the leaders of the world, the people who have the power to have Gaza reopened to aid, what would you say to them?
I would say to them that they need to speak to the children of Gaza, because once you hear from the children of Gaza, and remember that every second person in Gaza is a child, every second person, you hear from these children, it becomes simple. It becomes an obvious choice that we must stop killing children, we must stop injuring children, and we must provide them with the basics, very basics, at a minimum, that they need to survive. They need food, they need water, they need shelter, they need medicine. And when you talk to these children, there is no other answer. It becomes incredibly clear that that is the only right thing to do.